Hello, everybody. We're going to get started here in just a second. I'm going to let people kind of roll on in. All right, there we go. Like I said, we're going to give people just a few more minutes to come on in. Hope everybody is doing well this evening. All right. Well, I know I want to make sure that we are mindful of everybody's time. So I am so excited for you all to be here this evening. We are going to be talking about our Love Month and the different types of events that we're doing virtually. So this week, we are talking about where did my libido go? This is actually one of the #1 things that I see at my practice is the desire, the libido question, and talking more about, again, that kind of sexuality and that kind of burning desire, that rawness that you have in your belly. So with that being said, let's go ahead and get started. My name is Aleece Fosnight. I am a physician assistant. I'm also an AASECT certified sexuality counselor and educator. I opened up my own private practice, the Fosnight Center for Sexual Health, in June of 2020, and we are located here in Asheville, North Carolina. So one of the things that a lot of people ask me is why Love Month? Right? Why am I even doing this? So there's a couple of reasons why we really want to talk about love and intimacy and sexuality is because we don't have those conversations. And these should be conversations that we're having, just like, what are you having for dinner? Or what are you doing this weekend, right? These are normal conversations that we should have. However, over thousands of years, there have been messages and bringings and social media and Hollywood that skews a lot of that for us. That has brought up a lot of shame, a lot of stigma. So one of my hopes with Love Month is to destigmatize that, to really embrace sex and sexuality, not as a dirty word, but as something that we should find joy and pleasure in on our daily lives, not just with a partner, because that's what we often think is that you have to have a partner in order to do that, but more of that love and pleasure that we get from just ourselves. So let's go ahead and get started. Just want to remind everybody that there is a chat feature. Also, there is a question and answer feature also. So if you have a comment or you have a question, by all means, please make sure that you use those features during our presentation tonight. I do want to make sure that we have plenty of time at the end of the presentation for those questions. So if I look to see what those questions are, and I do feel like it's really relevant to the conversation that we are having at this moment, I probably will go ahead and answer those questions for you during that time. However, if not, I'm going to go ahead and just leave that to the end. All right, let's go ahead and get started. So libido, right? We hear this word all of the time, but it really is sometimes a mystery. Where did this word come from? And I always like to ask, especially my patients or clients, what is your definition of libido? What is it for you? It's very different for everyone. So when we actually think of libido, right, a lot of people think of it's that desire. Again, it's that fire to have sex or to be with somebody else. So that's a lot of times, but it can be very different. Libido for somebody can just mean this overwhelming feeling that they have with somebody else and that they actually want to be connected with. So when we think, though, about evolution and where libido actually came from, we have this Darwinian type of a thought process. So what this is more of that primal want and desire to procreate, right? That more or less lies within our what we call the reptilian brain of our brain system, meaning that that's going to be the root of that driving force that propulses us forward, so that we have to procreate, right, in order for our species to survive. So that's that part of it. Now, Sigmund Freud came in and decided that there were lots of other reasons why people wanted libido and what that libido actually meant. So, especially for Sigmund Freud, that libido term more or less meant those kind of psychological behaviors that people, again, were using for that driving force. For that. And a lot of that can be seen with what he discusses as these three distinct types of features in your body called the id, the ego, and the superego. And that he said that a lot of that libido actually lies in that id. And the id is going to be that pleasure principle for us. So again, that driving force to achieve that greatest amount of pleasure possible for this. This is more of the unconscious part of your brain that kind of, again, keeps it going. So now we have more of the ego piece of it, which kind of harnesses that libido. And it's that energy that's making sure that our libido is actually expressed in more acceptable ways, right? So when you're shopping down the grocery store and you're seeing somebody who's kind of attractive, that ego pulls you back so that you don't go jump them, okay? That's what that id would do. It would want to be like, oh, that's somebody that I want to procreate with, right? But no, our ego says, I don't think so. Is this a smart choice? Let's kind of look at the situation around us to see if that's really what we need to be doing. Now, the superego actually comes in kind of over top of that to say, what has our family values? What does our culture say about it? Is this culturally appropriate? So it takes it further to say, okay, let's look at this from more of a higher level of functioning to go, okay, is this really something that, again, our family would want us to do, that religion says is okay? So again, it's that next level of looking at the libido. This all leads to these, what we call what Freud calls the psychosexual stages. And where does that libido actually live? And where does it get stuck? So if everybody remembers maybe psychology class or what we learned from Freud, that there's several different levels, that oral is first, then we have anal, and then phallic, and then this latent, and then the genital phases that typically go from puberty on. Oral really starts in infancy and then builds from there. And depending on what stage you get stuck in, that actually determines the type of libido and sexuality that you actually possess. But Freud also said that there's limitations to the libido piece as well, and the fact that you only have so much reserve of that libido to give. And again, we know that there's not always necessarily that case. So that's when we start looking at kind of the modern day definition of actually what libido is. This is one of the models that we really embrace here at the Fosnight Center, and the fact that we use what's called a biopsychosocial model to approaching sexual health concerns and sexuality. When we break this down into these 4 different sections, and they all overlap, right? There can be definitely some combination of what we're seeing over all of these. So we have the biology piece of it, okay, kind of rooted in us. We have the psychology, more of the mental health piece of it. Interpersonal can be the relationship that we have with ourselves or with others, but then also looking at the social impacts, again, what is being said around us. So let's look at these a little bit closer. So when we start looking at the biology piece of it, again, these are going to be kind of your everyday physical health. If you have any disabilities, what are your hormones? Hormones are going to be really big and important here because these are all of our sex steroid hormones, right? So testosterone, estradiol, progesterone, all of those working harmoniously together to make our bodies function like they're supposed to. There's other types of hormones too, obviously the thyroid, our endocrine system, with our corticosteroids and the adrenals, our pituitary, all of those hormones in balance and harmony can help guide us in how our body is functioning so that we can have that optimal sexual health, right? Okay. The other thing that goes along with hormones is, again, remember we talked about the progesterone, testosterone, and estradiol. Those are going to be what I call like the trifecta, right? Those are going to be the three that we focus on the most when we talk about sexuality and kind of and mood and how you feel overall within your body. And I say estrogen and progesterone. And for you guys that might be listening to us tonight, you're thinking, I don't have estrogen and progesterone. And that's false. You actually have all three of those too. Again, it just all needs to be harmoniously balanced in order for you to function optimally. And whether that is you feel like you should be functioning more in a masculine type of body, more a feminine type of body, or even somewhere in between. When we talk about those hormones also, those three, especially testosterone, actually helps to set that foundation for these other hormones to interact. And those other hormones are going to be dopamine, oxytocin, and norepinephrine. When we talk about the different hormones that actually help to support sexual functioning, those are the ones that we're talking about. So those are going to be more of those excitatory types of hormones. Dopamine has been seen as kind of this overall good feeling, happiness kind of a hormone. It really lends itself to some of that motivation too. So remember we talked about that id piece of it and kind of those primal reptilian brain pieces of it and that driving force for that pleasure. Dopamine has a lot to do with it. It's that motivation. How motivated are we to actually move forward and have a sexual encounter with somebody? Oxytocin is another one as well. Oxytocin has been seen as that bonding chemical, really important when you look at relationships and partners. Every time an orgasm actually happens, oxytocin is released during that time. The other time that oxytocin is released is during breastfeeding. It's that bonding chemical that we have with our children and our young after we go through labor and delivery. So that's another way that we bond and don't eat our young like some other types of species actually do. The other interesting thing about oxytocin, and Helen Fisher was a famous sex researcher and talked about the importance of oxytocin when you are selecting who you are actually sharing those sexual encounters with. And that you want to be careful of who you're sharing orgasms with because oxytocin is released and you never know who you will be connected with. And even on kind of that unconscious, very deeper level, that actually can cause an unconscious bonding with somebody. So although I'm down for whatever types of sexual play that you want to engage in, I think when we think about evolution and biology, that we can't really get away from those roots, and that those are the things that are really important. Medications as well can definitely skew our view of sexuality and how we respond to those cues. A lot of medications can lower that threshold for libido, making it much more difficult for us to actually meet where we need to be. Genetics, right? We can't help if you have a short stature, or if you're tall, or if you have a long torso, or if your hips are the way that they are. Those are things that we necessarily can't help. Different types of surgeries as well. So one of the most common surgeries that women actually go through is going to be a hysterectomy. And that has huge implications on your sexual functioning. Okay, so let's move over to the psychological part of things. Again, this is more mental, right? So, so we definitely look at the types of disorders of depression and anxiety, of being that overall, how would you rate your emotional health? And thinking about that right now as you are listening through this presentation is, where is my emotional health? And remember that this changes on a daily basis. It changes on an hourly basis, depending on the type of information that your body is processing and what's going on with your surroundings. Did you get enough sleep? Did you have something to eat? Did you just get a call that somebody that you are really close to is sick and in the hospital? It's the emotional health piece of it and how we deal with that really, again, has an impact on our libido. And our coping skills, right? Like that's going to be really important. So when we start talking about having babies, right, and pregnancy, that if we can't cope through that time and asking for help and knowing our support system, that can make it very difficult for that libido to pop up there as well. And then we definitely know trauma. Trauma has a huge impact. And we're not just talking about sexual trauma, but other types of cultural traumas, societal traumas, especially. And so we'll talk some about that too. Trauma actually spills over into social also. So you'll see it listed twice. Now, what about interpersonal? Again, these are the types of relationships that we have with ourselves and with our partners and those that are surrounding us. So when we think about like partner performance, so if our partners are struggling on their sexuality or sexual expression, it spills over to you as their partner. And that can cause you to have some sexual concerns as well and some difficulties. And then looking at the quality of relationship as well. Is there trust? Is there a connection? Did you all share a meaningful experience or an encounter together that bonded you together? Periods of abstinence. So times when we're not having that connection. We know that as human beings, this is really important for us to have connection with other people. And that connection isn't just having a conversation with them, it's embracing them. It's the touch, it's the kisses, it's the hugs, it's all of that that really highlights those neurochemical pathways in our body to make us feel good. And again, to have those connections. Finances are going to be a big one, and that's a huge stressor too. When we think about going out on a date or creating or buying a gift for somebody, if that is going to be stressful for us, it's really difficult to possibly show a connection or intimacy with that other person, romance, showing romance with that other person as well. Looking at the social influences that we see, you see trauma is here as well. Peer relationships, it's the relationship that you have with your friends. Do you have a support system of friends? It's going to be really important. Expectations, right? This is going to be really important when we talk about setting realistic expectations. We, again, are very skewed by Hollywood and social media and the movies about what sex in a relationship should actually look like. So when we start talking about setting realistic expectations, that can really help with the libido side too. And cultural norms, right? It may be normal right now to have no pubic hair, right? And so if you get into a relationship and somebody's a la naturel, and that's not what you expected, right? Sometimes that has influences as well. And then obviously our upbringing, it's our family values, it's religion, it's those morals that we actually all have for one another. Okay, so now that we have all of this, that leads us into talking more about what we call the dual control model. If you haven't heard about Emily Nagoski, she is amazing. I would Google her right now. Well, not right now, but after this talk, Google Emily Nagoski TED Talk, because she has a very short, I think it's like 17 minutes. It's not long at all, but she really talks about how this concept of this dual control model really shapes and influences us when it comes to sexual arousal and sexual desire. Again, that libido piece of it. So when we're thinking about, again, this type of model, there's two brain components to it. And that really relates to the initiation, and the conclusion of a satisfying sexual experience. So when we think about the accelerator and the brake, right? So this is going to be the go and the stop of this, which is, again, is going to lead us down the path of, is this something that we feel okay doing, or do we need to stop and back up and go, I don't really know if we need to do this. So when we think about on the accelerator side of things, again, this is going to recognize that sexuality is moving more towards something that's very pleasurable. So we're thinking about that positive reward system within this type of scenario. So it's that feeling safe and secure within that encounter. So this definitely embraces that love piece, the bonding piece, how we respond to, again, explicit or erotic cues. if we're looking around and feel that something is really safe and pleasurable, there's low stress to it. There may be, again, a trust factor where we've built that connection, and we're talking about that on those romantic behaviors. So now when we move over to the break piece of this is where we're avoiding anything that does not give us pleasure. This is where our body responds to stress, other types of inhibitions, if there is a threat. Again, this is more of that reptilian piece of our brain, that primal part of our brain that says, I really don't think that this is okay for us to do. The thing about what we just saw on the biopsychosocial model is that all of those things influence whether we have accelerators within this relationship or breaks with our relationship. Accelerators are actually pretty easy to define within your daily relationships, again, with yourself, with your family, with a partner. The thing about breaks, again, very rooted in that, that basic fight or flight within our body. And so that is huge. You can barely tap on that brake and it's going to overcome that accelerator every single time. And so it's learning how to take your foot off of the brake and use that accelerator. You can't accelerate and brake at the same time. It's just not going to work. And so really, again, embracing that and recognizing, okay, what in our life right now is causing me to put the brakes on? Why am I feeling the way that I am? And again, it's all of those biopsychosocial factors and influences that are going to be pushing that brake. So if you had a very traumatic experience from a car accident, and I do want to remind everybody that sometimes this gets a little deep with conversations. And I want to make sure that if anybody is feeling triggered, that you go feel a safe space, because we will be talking about some, again, traumas. And I definitely want everybody to make sure that they feel safe and comfortable within their own bodies. So again, if you're feeling uncomfortable right now, by all means, take a break, step away. These are being recorded. So if you ever wanted to come back and look at them some more, you have that opportunity to do so. So say that you are, again, in a traumatic car accident, lots of injuries. It's going to take you a little bit of time to get back into that car to feel safe again. And so that memory and that traumatic experience is your break. And that's in your brain forever. There's no way that we can actually remove that memory from your brain. So what we have to do is learn, okay, what is it that's going to make me feel safe in order to get back into that car to move forward? And it's helping our bodies to remove that traumatic experience, place it someplace else that feels safe off to the side. And we'll talk about ways that we can actually do that as well. So there's lots of medical reasons, right? Almost everything out there can cause problems with your libido. When we start talking about the hormonal side of things, we're talking about menopause and andropause. But you can also have hormonal fluctuations based on your menstrual cycle or pregnancy or postpartum, or if you're breastfeeding. So all of those have influences on your hormones. When we think about menopause, we often forget that women possess testosterone too, and that actually women have 10 times more testosterone in their body than they do estrogen. So again, if the thought process is that men have testosterone, women have estrogen, again, that's not always the case. And so with that being said, oftentimes we will look at replacing estrogen and progesterone for a woman when they are going through menopause, but that's not always the trigger. Again, most people forget about that testosterone piece of it. And we'll talk about some options for treatment here in just a sec. On menstrual cycles, again, let's go back to the biology piece of it and evolution. So again, whenever you ovulate and you have that big LH surge, which is that luteinizing hormone to release that egg to go, you definitely want to find a partner at that moment so that you can send that sperm up to that egg in order to have conception actually happen. So you will definitely have more libido during that time of your menstrual cycle. Again, pregnancy heightened a lot of hormones, postpartum, a lot of dips in hormones after you pop that baby out. And then breastfeeding also can do that too. Breastfeeding actually causes an increase of prolactin as well. Prolactin is one of those inhibitor hormones, so it's going to block that testosterone, block that dopamine, block that oxytocin a little bit too. We do see some oxytocin again, well, like I said, with breastfeeding, but again, that prolactin is really going to trump that testosterone. When we think about heart disease, this is more of an indirect influencer on libido, meaning that it's going to limit the type of blood flow that you have. So if you're not feeling as aroused in your genitals, then you're not going to be feeling desirable as well. That goes for both people who are penis owners and those that are vulva owners. Diabetes is kind of the same way. Diabetes interacts on the blood flow piece of it and some of the medications that go along with diabetes. The other thing that we see with diabetes, we hear a lot about peripheral neuropathy and the loss of sensation or the increase of sensation in that area. Most of the time we have a decreased sensation. We think about this in our feet, in our legs, but I have seen it multiple times in the genital region. If you're not feeling sensation in your genitals, then that can be a really downer with going, well, why would I even want to do this in the first place? Thyroid, okay, this is another hormonal type of piece here, where we think about that can really influence your testosterone and how you're feeling overall as well. When I do my hormone panels and we talk about labs and getting those tested, I always add in a thyroid panel so we can look to make sure that your thyroid is functioning as well. Again, everything needs to be in harmony. Cancer, both surgery for cancer as well as the medications that cause cancer, or excuse me, medications that treat cancers. Most of the times, especially if we're thinking about breast cancer, gynecological cancers, prostate cancers, we're decreasing all of those sex steroid hormones. So the testosterone, the estrogen, and the progesterone. And so that's going to limit our libido also. If you are having sexual concerns in other aspects of your body, meaning like for instance, with the penile types of concerns, if you are struggling to get an erection, or if you're struggling with premature ejaculation or delayed ejaculation, or you have a disease called Peyronie's disease, where you have a curvature of the penis that makes penetration difficult or sometimes impossible to happen, why would you want to desire a sexual activity if you're already struggling and can't even get there? So that can do that too. The other things that we think about on the female side of things, if a female is unable to orgasm or has difficulty reaching orgasm, that can be also, again, why would I want to do those things? You're not getting that positive feedback loop that says this is good, this is something that we want to do. The pain side of things too, especially with pelvic pain, or what we call dyspareunia, which is painful intercourse, those are going to block you every single time. So I tell people that your body is super protective and it doesn't want to keep doing activities that are going to cause itself pain. So again, when you have pain and consistent pain, even chronic pain. So my people that have fibromyalgia, chronic lower back pain, other types of arthritis, orthopedic pain, hip pain, all of that is going to lead to decreasing your ability to have that desire, that sexual desire. The other thing that we think about with pain actually eats up your testosterone. So that pain process and pathway is going to take a lot of that testosterone, so it's going to lower it even more anyways. All right, so let's talk about some of the medication reasons that you can have low libido also. All right, medications. There's a long list here, right? So contraception. This is a great conversation to have that not a lot of people know about. So contraception, meaning like birth control. So when we think about birth control pills and it being orally, right, we're taking estrogen, we're taking progesterone. What happens though is that because you're supplementing your body with that, your ovaries stop working. They don't want to produce, which again helps you not to get pregnant. But what happens, is that it's going to lower that, and it's going to lower your testosterone, and that's going to make you not want to actually have sex. Another side effect, I guess, of not getting pregnant. But again, it's not fostering ourselves and what our rights are as human beings to be able to really enjoy that sexual pleasure. We talk about antidepressants and anti-anxiety medications. Those are going to be like your SSRIs, your SNRIs. So when we think about Zoloft, Celexa, Lexapro, Paxil, Prozac, all of those types of medications are going to impact definitely as well. The reason that they do that is it works on serotonin. So serotonin there's lots of different serotonins out there depending on where it is in your brain. And so what happens is this serotonin is kind of that happy chemical, also that neurotransmitter in our body, but it's also an inhibitor of function. So when we think about these serotonin selective reuptake inhibitors, and you're not getting as much of that, it's inhibiting that libido as well. When we think about prostate medications, Flomax, finasteride, or Proscar, those are all directly related to decreasing your testosterone as well. Antipsychotics, so this is going to be like the Abilify that people are taking, Seroquel, Risperidol. So again, it's that feedback loop, and it's stopping that from actually happening. People often don't think about antihistamines as causing problems with your libido, but it can, especially for chronic users. Antihistamines can also dry up things. And so when we think about drying up mucous membranes, the vagina is a mucous membrane, and a lot of women can have difficulties with lubricating and feeling aroused, which a lot of times leads to that low libido as well. Blood pressure medications, same kind of thing with when we talked about heart disease and causing blood flow problems. The same thing happens here is that we don't get enough blood flow to the genitals. That really limits our ability to be aroused, or when we start talking about some responsive desire, that's going to limit it as well. So steroids also, like our prednisone, is going to increase those stress types of hormones in our body, which are like cortisol. Cortisol, again, is another inhibitor of that libido. Opiates, so your oxycodone, your Percocet, Vicodin, are all going to be on short courses of them, a couple of days, that's fine. That's really not going to impact necessarily your libido. However, when we're talking about chronic use of these types of medications, it's really going to eat up your testosterone as well. It's so funny, right? We're taking these types of pain medication because we have pain. Remember in the previous slide, it said, pain is one of those things in that inflammatory process. So if you have pain, that's one thing that's going to cause libido issues. Now we're taking medication to fix it. Now you got two things that are causing problems with your libido. So it's really going to go, down the drain. And then alcohol, right? A glass of wine here and there, okay, no big deal. But we're talking about chronic alcohol abuse and really looking at overuse of alcohol a lot of times as a coping mechanism as well. We do know that when we start talking about the types of serving sizes when it comes to alcohol intake, a lot of people don't realize what those limits are. So when we talk about for our female patients and intake of alcohol, it really is going to be 1 glass of wine, which is actually 4 ounces, one beer, which is 8 ounces. And then when we talk about our hard liquor, it's 1 ounce. That's per day. Okay, not all 3 of those, just 1. That's 1 serving of alcohol a day. When we talk about men, it can be anywhere from 1 to 2. So when you go actually to pour your glass of wine, typically 4 ounces is pretty tiny, but we fill it all the way up, right? You're talking 2, sometimes 3 servings of those alcoholic beverages. And over time, if that's happening on a daily basis, that can really tank your libido also. So let's talk a little bit about some psychosocial reasons that that libido can be disrupted also. So relationships, okay? So if there have been affairs, if there have been infidelities, if you're feeling like you can't connect or trust your partner, again, you've lost that connection with them, something's going on. If there are unresolved conflicts, or fights that you are having with your partner, right? If they forgot to take out the trash, or if they forgot to start the dishwasher that night before you went to bed, right? Like you get frustrated, or you had an argument about who was picking up the kids or anything like that. why would you want to have sex with somebody if you have this conflict that's going on with them? And so it's not, again, uncommon that people are upset, and then they either hold on to it before they get a chance to talk about it, and that's just, again, going to be a turn off for that partner. And there's poor communication. We can't read our minds. And I was just having a conversation with a patient earlier today about we all suck at communication. And it's really difficult. We can't read minds. Right. And it's hard to have conversations and to be vulnerable and to come out and say, I don't know what's going on. Can we talk about this? I'm not feeling good. And really using, our I statements and recognizing that these are our feelings and taking accountability for that, rather than saying that somebody else is making us feel the way that they are. Maybe their actions, something like that could be going on. But again, we have no control but ourselves about the way that we are actually feeling. So communication is super important there also. And we talked about those interpersonal types of influences with how partners are performing. So this can be it too. Again, I see a lot of this. I'll have a female patient come into my office and they will say, that they've got low desire, they're not feeling sexy anymore, that this has been going on for a couple of years. And we open up the conversation and I ask them, like, hey, well, how is your partner functioning? And if their partner is a penis owner and they're struggling with erections and they had prostate cancer and they feel like they can't perform because they can't get an erection and have, again, the normal type of sexual activity, which is penis and vagina sex, then they avoid intimacy. Then that spills over into that partner. And well, maybe it's because I'm not attractive anymore. Maybe they don't like me anymore. When really it was the partner's concern that was the start of this whole snowballed event. So again, piecing out what's going on is going to be really important. Again, we talked about mental health and the emotional health that you actually have, and anxiety and depression can really put a damper on that libido as well. If you have a poor body image or low self-esteem, if you're not feeling confident in who you are, that's going to be difficult for you to increase your libido and feel that you want to engage and want to connect with somebody also. We've talked about history of abuse, trauma, and assault. Those are going to be a lot more scars that are happening to your brain that's getting stuck. It's a huge block, a huge wall. It's really difficult to get over those types of events and encounters that actually happened in your past. If you have had negative sexual experiences, I know that I've seen this a lot, again, within my practice, that somebody had a partner and said, that's how big your penis is? That's it? That's not okay. Or they had somebody that said, that, well, your vulva looks weird. That's not how I'm used to seeing something like that. Again, that can be a very big negative impact, especially on how you feel. It was during a sexual encounter. This is supposed to be romantic and connecting. And again, very hot and desirable, and blew it with that. And so we hold on to that. The other thing when we talk about shame and the stigma, again, it is what we have been programmed over hundreds of years, especially through religion, through family values, that sex is supposed to be reserved until marriage. Or again, masturbation is not a good thing. And so we bring in a lot of shame that's associated with that. And again, those are difficult things to get over. Stress and lifestyle. Okay, when you are fatigued and you're exhausted, that's definitely one of those things that your body is on survival mode, right? It doesn't want to propulse itself forward in order to have sex. It's saying, no, I don't have the energy. I don't have the reserve actually for that. Lifestyle is going to be a big one too. If you're not getting enough sleep, or if you are eating poorly, or you're not exercising, all of those types of things lead to, again, how your overall well-being is, and that's going to limit how you're actually feeling with another partner or even with yourself. So one of the big things that I talk to a lot of my patients about is the difference between spontaneous and responsive desire. So like you see here on the left-hand side from the famous When Harry Met Sally, right? So we see in the movies. It's spontaneous. It just happens. It happens when it's raining outside or when they're in the back of a car and they just met one another. And 10 seconds later, they both had to have an orgasm and that's it, right? So that is what we call an unrealistic expectation. And what we need to try to help people to understand is that spontaneous isn't always what actually happens. And that in real life, when you're there doing the dishes or you're cooking or you're folding laundry or whatever you might be doing, something that's just not sexy, unless you find folding laundry sexy, and your partner comes up behind you, right? They wrap their arms around you, they start kissing at your neck, and then all of a sudden you start to get a little bit turned on. You're feeling your body going, this feels nice, feels good. That's responsive desire. And so again, helping to understand the difference between those two. When we think about spontaneous sexual encounters, yeah, there could be some of those, especially maybe early on in the relationship. But we do know that as relationships ebb and flow, that's not always the case, that spontaneity wasn't always there. For example, when we think about somebody, you're dating somebody and they say, and it's Tuesday, okay, for instance, and they go, hey, do you want to go out to see a movie on Saturday night? Yeah, sure. Let's go do that. And so you're thinking, okay, now it's Wednesday. It's getting closer. What am I going to wear? What am I going to do I need to shave my legs? Do I need to straighten my hair? How should I wear my hair? What kind of perfume should I wear? All of those types of things are starting to go through your brain to say, okay, maybe some sort of intimacy or kissing. I need to make sure I have good breath. All of those things. You're thinking that sex may actually happen or some sort of sexual activity. So again, it's not spontaneous, right? That little seed in your head thought, okay, maybe this was actually going to happen. So again, those are the types of things. And that, especially for women, when we talk about desire, it's not always innate in us. That again, it's more that responsive piece. And then moving towards the desire piece is what we actually see, and that's okay. And that there really isn't anything wrong at that time. It's because you're responding to those cues of what your partner is actually sending you. Okay, what about treatment options, right? So, okay, Aleece, we have this issue. What are we going to do? So again, we talked about here at the Fosnight Center, we take a biopsychosocial approach to it. It's a team. It takes a village in order to work at this. I could throw all of the testosterone at you in this world, but if you're still having relationship concerns, nothing is going to get better, okay? So again, we work on that kind of approach. So not only do we have the medical person, so me as a PA here, that can take that medical approach, but we also have a pelvic PT as well that can help, especially if your body is holding on to some of that trauma and that tension. If anyone has actually read The Body Keeps the Score, we talk about, there's issues in your tissues, meaning that your body holds on to that trauma, and that we need to help it kind of release that through more of a manual type of therapy. And that's definitely having that mental piece to it as well, so that we can tackle some of those emotional pieces, the relationship concerns, and some of the trauma that you actually had. When we think about, is everything working like it's supposed to? Remember we talked about labs that we could do earlier on. This is it. So I'd like to check kind of a panel of hormones. We can see what's going on and see where your levels are actually at. When we think that there is testosterone, a deficiency for both our males and females, we definitely can start you on some testosterone. But again, everybody is a little bit different, and I encourage you to talk to your primary care providers or your other specialty people to say, hey, I want to check my hormone levels just to kind of see where they're at, because I'm having some of these issues going on. For men, we can definitely do testosterone. It's been FDA approved for them, if that's an option that we need to do if testosterone is low. For women, that's not the case. We don't have an FDA approved formulation for testosterone for women. However, we can use a compounded form that can actually help beef up the testosterone. Not only does testosterone help with libido, but testosterone helps with energy, mood, sleep, removing kind of that fog, that brain fog that a lot of my patients say also. The other types of medications that are out there to help with low libido are actually been FDA approved for women. So we have Addyi, which is an oral medication that you can take that helps to really focus more on the thoughts in your brain on what's going on. So remember, we kind of talked about that excitatory and those inhibition. So with the accelerators and brakes and that dual control model. So when we think about low libido, what happens is we have huge increase in our inhibition and low accelerators. What Addyi helps to do is to shift that. So it lowers the inhibition and again, raises that excitation so that you're starting to have those thoughts. You're starting to think more about sex and desire. Now, again, a pill does not fix everything. And you have to work on that relationship, not just with yourself, but with that partner as well. Flibanserin or Vyleesi is another one. This is more of an on-demand type of medication that you can take. It's an injectable sub-Q injection right into your abdomen. And within about 45 minutes to an hour, again, that medicine is helping to release some chemicals in your brain so that you're starting to think about desire. The problem with that, though, it's very on demand, meaning that you do have to kind of schedule. And if you're having any kind of performance anxiety, that can increase that. So again, it all depends on what your individual needs are. So again, talk to your healthcare providers about that. It could be a phase. Right. So when we talk about different phases, it could be that you are working on your dissertation for your PhD and that you have to cram this in for 6 months. Right. Recognizing that this might be just a short-term problem that's going on in your life can help you to accept that fact and go, okay, and talking to your partner right now, this is what's really important. This is what I have to get done and moving forward. The other thing that we think about, again, is pregnancy and that postpartum phase. We really get stuck in having a baby and what am I supposed to do and going, am I ever going to sleep again? There's the exhaustion part of it as well. So when we look at that, we help to troubleshoot that and then look at how to strategize the next best steps and what are the things that we can do to keep that intimacy still there, but knowing that it may not be as frequent or that we don't necessarily have enough time to do the frequency of sexual activity that we need to. Focusing on making lifestyle changes is going to be really important as well. I mean, again, like getting sleep. Okay, you need 7 to 8 hours of sleep every night for your body to fully function like it's supposed to and repair from the day that it had. Making sure that you're drinking enough water. Okay, you need depends on who you are and whatever else, but anywhere between 70 and 80 ounces of water a day. Coffee and tea do not count. So you need that water again for those hormones in your body to function like they're supposed to. Make sure that you have a well-rounded diet, making sure that you're getting some exercise, making sure you're getting outside is going to be really important, especially right now where we're all kind of cooped up inside. We need to make sure that we get some fresh air and get outside. It's going to be really good for us head to toe. Making a schedule, scheduling intimacy. We schedule everything, right? We schedule our hair appointments. We schedule when we go to the gym. We schedule when we're going to go out to lunch with friends or go meet our buddies for drinks at the bar. So scheduling this should be part of it too. Again, we have that resistance of, I don't really want to schedule it because then it feels forced. Then it feels like there's an expectation. But when I say make a schedule, it's not necessarily, okay, like sex is going to happen. Make a date night. Make time to actually be with the person that you want to be with. You make time for everything else. And if you don't put it on your schedule, in your phone or in your calendar, it's never going to happen. If you think, oh, we'll do that. We always have Fridays. Time will get away from you and it's not going to be as productive. And then the thought of that, okay, well, we were supposed to have a date night or we were supposed to have an intimacy date and it didn't happen. Then you get frustrated, right? We thought we had planned this. But if it's on the calendar and you make arrangements either for a babysitter or that the kids are going to go watch a movie and you're just going to have some alone time, then that's what you need to do and don't push it off. Put it on your schedule. Focusing on self-love. You cannot pour from an empty cup. Okay. If you are going to connect and have love and intimacy with somebody else, you've got to know how you do that with yourself. Okay. That's going to really help when communicating what your wants, needs, and desires are for that relationship and that sexual encounter. So again, making sure that you are taking care of yourself. That means scheduling some time just one-on-one with you, whether that's in the bath, whether it's going to the grocery store and spending 10 extra minutes down the cereal aisle just because you can and you're by yourself, whatever that might be and whatever feels good for you and your body. Getting back to the basics, we put such a high expectation on penis and vagina sex. And that's the gold standard. But there's so much more to kissing, to holding hands, to embracing, to touching your partner on a daily basis. So we're getting back to those basics and those fundamental types of behaviors that you have with your partner is really going to help foster then building up that libido and that desire again. I always tell people too, it's okay to ask for help, and seeking professional assistance is one of those types of things. If you've had trauma in your life and you're finding it very difficult for you to get up and over those walls that we've created as a protective mechanism in our body, doing things like what's called EMDR, which is an eye movement, desensitization, resensitization type of exercise that you do with a mental health professional. Again, it helps your body to rewire those chemical pathways and set that experience off to the side so that you can now streamline and get to your goals like you want to. Having somebody talk it out, having a mediator, you might need some couples therapy, and that's okay. Asking for help and asking for assistance is okay. There's nothing weak about it. If anything, there is strength in asking for help. The other thing too is to think about arousal happens in the brain. Yeah, our genitals respond, but it's really that thought process. Our brain is one of our largest sex organs outside of the skin, but it really starts there. We have our limbic system. We have all of those neurochemicals that are being released and those neurotransmitters. So that's really where it starts. And it's that positive feedback loop that's actually making you want to have sex. When things feel good, it's that positive loop feedback. You want to do more of those. So I, tease people all of the time, orgasms feel good. And it is those chemicals in our body that we are not only bonding to ourselves, we're bonding to a partner. So if I could write a prescription for an orgasm a day, trust me, I would. And so to think about what are those pleasurable activities that you actually do in your daily life? Is it that you like to draw? Is it that you like to go to do archery, or you like to play a sport? All of those things bring pleasure. And in your body, you don't always differentiate between the pleasure pieces of it on a sexual side and the pleasure pieces of it that just bring you pleasure and joy in life. You need all of those types of things, again, for that harmonious type of balance to actually happen. So again, right between the ears, okay, is it all starts within that brain. I wanted to make sure that you all had some resources. We talked about Emily Nagoski. Her Come As You Are book is fantastic and fabulous. I talked a lot about that dual control model with those accelerators and brakes. Sex Matters for Women is another good one. It talks a lot about libido and the different stages of your life, and really is good for any female in your life. Transsex is actually coming out this summer. Aleece Fielding is one of my good colleagues, and she's really done an amazing job with this book to talk about the things that for those trans folks that they can seek some assistance with also. We talked about the brain, and everything starts within that brain. Mindfulness is one of those techniques that you can do to help clear your thoughts, be in the present, and clear all of that clutter out of your brain. So Lori Brotto actually does a really good job with talking about better sex through mindfulness, and then how we can cultivate that desire. I do have some male patients that have read this and found it very helpful, although it is geared more towards females. Esther Perel is one of my very favorites out there. She talks about mating in captivity here, and again, kind of unlocking, just like I said, that erotic intelligence, looking at can we desire what we already have? Because we do know within relationships that, again, we talk about the ebb and flow of libido, that things get complacent, things get normal, and can we really continue to desire something that we look at as normal and not exciting anymore? Then here are several websites that you can go to, also that has some really good information on there about libido, again, for those that are penis owners, that are vulva owners, and again, anybody in between. So like I said, I wanted to make sure that we had enough time to talk about any questions that anybody actually might have had. So I'm not really seeing, let's see, there's somebody in the chat. So you mentioned the negative culture, shame, and stigma messages around sex that impact a person's libido. What would you suggest is the best way to fight against the stigma on an individual or personal level? So I never want anybody to go against their culture or go against what their religious upbringing has shown us. What we try to do it in a very healthy way is to meet that person where they are. And so helping them to understand that what are some different ways that you can have sexual expression. So for somebody who's not allowed to touch their genitals, but really enjoys masturbation, how could we put a blanket between where your hand and your body is? Again, finding what feels safe for that person and acceptable. So I'm hoping that that answers some of your question with that. The other things to think about, again, culture is talking to that individual about helping them to understand where they're coming from, and that we understand how this negatively impacts how they're functioning sexually, and moving forward past that with, again, meeting them where they're at. We don't want to necessarily get rid of all of those messages that they got. A lot of people hold on to those religious upbringings that mean something to them, or those family values. By all means, we don't want to negate those completely, but again, meeting that person where they are. That's going to be that's a tough one to really answer, because that's more general, but everybody's going to be a little bit different of where they're actually coming from. And so we, again, use techniques, talk therapy, EMDR, to help them move forward past some of those stigma and shame messages that they have. Does anybody else have any questions? Well, by all means, my email is on here. So if you have any questions, by all means, feel free to send them to me at Aleece@fosnightcenter.com. I'd be happy to answer those. Thank you all so much for joining us tonight. This was a pleasure. Again, it is being recorded, so you'll be able to view this again. If you want to share with your friends, your colleagues about this talk, please do so. Be on the lookout over the next week for those videos to be uploaded. We do have a lot of other events that are coming down the pipeline in the month of February. Join us next week for how we talk about how to keep things spicy and hot within your relationship. On the 23rd of February, we actually have sex trivia. So if you want to get together with a team, and I'll be sending out instructions for how we're going to do that. And then on March 2nd, we're going to have a panelist, and it's going to be an Ask Us Anything. Doesn't matter what it is. I want to bring on those questions and be able to answer all of those tough ones for you. All right, thanks so much. I hope everyone enjoys the rest of their evening, and I will see you soon.